A week and a half since Donald Trump was diagnosed with COVID-19, he's making it clear he's learned little to nothing from the experience, nor have his top supporters, like Florida Governor Ron DeSantis, who inexplicably high-fived crowd members as he walked, without a mask, into last night's Trump rally just before the president delivered these head-scratching remarks.
The cure cannot be worse, but if you don't feel good about it, if you want to stay. Relax, stay. But if you want to get out there, get out. I went through it. Now they say I'm immune. I feel so powerful. I'll walk into that audience. I'll walk in there. I'll kiss everyone in that audience.
While Trump is likely no longer contagious, likely has some degree of immunity from the virus for now, there's been no evidence that recovering from COVID-19 gives you any permanent immunity. And in fact, there have been well-documented cases of people being reinfected with the virus. And as for the wisdom in packing people together for his returning tour, well, I'll leave that commentary to the good Dr. Fauci.
We know that that is asking for trouble. When you look at what's going on in the United States, it's really very troublesome. It's going in the wrong direction right now. So if there's anything we should be doing, we should be doubling down in implementing the public health measures that we've been talking about for so long.
Meaning masks and distancing, and really none of what we saw on display last night. Right now, coronavirus cases are increasing in a large majority of states, including right here in Massachusetts, where our positivity rate topped 4% yesterday. And the 7-day average of new cases nationwide is up 14% compared to just a week ago. In all, more than 215,000 people in the U.S. have died from COVID-19 so far. And while the president likes to repeat this claim in various forms over and over,
we've probably done the best job of any country, certainly of any major country anywhere in the world, on the pandemic.
A new study in the Journal of the American Medical Association this week shows with cold, hard facts that couldn't be further from the truth. I'm joined now by a co-author of that study, Dr. Ezekiel Emanuel. He's an oncologist and former White House health policy advisor under Obama. He's now the vice provost of global initiatives at the University of Pennsylvania and the author of Which Country Has the World's Best Healthcare? Spoiler, it is not us. Doctor, it's good to see you. Thanks so much for being here.
Nice to be with you.
Now, before we get to your study, I'm watching you last night on CNN, and you're talking about bad modeling, specifically by the president. And I know you're an oncologist and an ethicist, not a shrink. But I don't want to talk about leadership. I want to talk about what the former Speaker of the Mass House called followership. Can you explain to me how so many people do so much that is antithetical to their health in this country?
Well, I think part of it is that they just don't understand or want to deny that it actually is going to imperil them. And part of it may be they don't know anyone who's gotten the illness. Part of it is that they simply are suppressing the facts. I mean, there have been interviews with people who are at Trump rallies who say, yes, someone I know either got COVID and was in the hospital on a ventilator or even died, but I don't think it's real. And you're like, what connection are you missing there? And it really is flabbergasting. I do think there's a lot of norming. So if you're in a, information bubble and that bubble keeps saying either it's not a real virus, but now it's a real virus, the president got it, but it's not that bad. You can bounce back. Look, the president was only in the hospital 3 days. He looks perfectly normal. He's feeling, high. Well, you take that as your piece of evidence. And this goes along with, the rise of populism and the denigration of expertise.
Well, and the anti-science era we're in. Very briefly, though, you're put on your ethicist hat and talking about suppressing information. If you're Redfield at the CDC, Dr. Redfield, Dr. Hahn at the FDA, Dr. Birx, do you not have an ethical obligation when you work for a person who's got a huge bullhorn to at least correct information that he puts out that is dangerous for the health of the people to whom he is speaking? Well,
I think the perfect role model is Tony Fauci. When you think of adjectives about Tony Fauci, it's, rectitude, integrity, competence. And he it's quite clear. What is his primary ethical orientation? His primary ethical orientation is, I am a servant of the public. I work for the public. I want to promote their health. That's my job as a physician inside the U.S. government. And I'm going to provide the information and whatever other things I can provide, in his case, research, to promote their good. And when things don't promote their good, I'm going to speak up. I think getting that ethical orientation, what's my primary obligation as a government servant, is the key element. And Tony Fauci's done. I mean, the reason people are so thrilled with him is he's been the model, really the paradigmatic, ideal case of that. And, you know, I know Steve Hahn a little bit, and, you know, I just hope Steve Hahn recognizes that that's his job. And I think to some degree he's learning that, but because he put out these standards for an EUA related to a vaccine, and he insisted on them.
He didn't do so well with hydroxychloroquine, but maybe that's ancient
I totally
history.
agree.
So
that's why I said I think he's learning.
I understand that. I'm on an eternal search for good news, and you sure as hell don't find it with your study in the journal. Give us the bad news, Doctor.
Well, the bad news is that tens of thousands, maybe even 100,000 Americans died unnecessarily, even after the first big flush of problems in March and April. So what we did is to take the United States case and compare it to 18 other high-income countries, from Australia to Germany and Canada to the countries that didn't do so well initially, like Italy and Spain and the Netherlands and France. And we said, you know, how many more deaths have there been compared to these countries? And we did it right from the start, from, you know, mid-February. And then we said, well, you know, the March-April time period was everyone was struggling. No one knew exactly what to do. Let's evaluate how we did compared to, for example, Italy, beginning on May 10th, after the first big, you know, crisis hit the system. And it turns out
how did we do compared to Italy?
Terrible. We had 90,000 on a per capita basis, 90,000 excess deaths. If we had followed Italy's example and had the same death rate as Italy, we'd have saved 90,000 Americans to mid-September. So that included Italy's bump up with their August vacation. And that's the bad news. And Italy's not unique. It's the same for France. It's the same for even Sweden, which didn't do anything initially. We have just underperformed every other country, Canada, Australia, by more than 100,000.
You know, Carl Bernstein, also on CNN, has taken to calling this, he didn't have your study when he said it, homicidal negligence on the part of the president. I'm a lawyer, but doing a non-legal analysis, if you know what the facts are, you know what the fix is, and you voluntarily choose not to embrace that fix, Bernstein is not being hyperbolic, is he?
Well, I do think that, yes, those are unnecessary deaths, and they're unnecessary because of failures of leadership and failures of actually implementing and modeling the public health measures, right? I mean, I've said this before, and I'll just repeat it. Italy didn't have a vaccine when we, you know, at this time. Italy didn't have a special treatment that we didn't have in the United States. The only difference between Italy and the United States in May, June, July, August, and part of September is they actually conscientiously implemented the public health measures. They made it the norm to wear masks. They even opened up in a very sequential way, in a much better way than we have. You know, you see Ron DeSantis in Florida. Everything's open. You know, it's predictable. Right after Thanksgiving, before Christmas, there's going to be a big uptick in cases in Florida. It is absolutely predictable, and it's going to be tragic because many people will die as a result.
You know, a lot of people are putting hope in the possible election of a guy you're consulting for, Vice President Biden. But how quickly can a President Biden turn around the Titanic, particularly if a losing Donald Trump uses November 3rd to January 20th to exacerbate those crises that he has already exacerbated? Do you know what I mean?
Well, I do know what you mean. I do think there are many levers that the president can pull. Even as a president-elect, people will be looking to Biden. So one track is just modeling the right behavior, getting on sports celebrities, other celebrities,
right.
business leaders, to model the right behavior and to be very public about it. A second is to take control and to talk to everyone involved in the need to get a vaccine produced, distributed, and administered to people. That's by no means do they have the infrastructure ready now. There are a lot of potential hurdles, whether it's glass vials, syringes, needles, or just the administration process. So you've got to get that under control. You have to make sure that there's testing, it gets ramped up and appropriately used. PPE is available and distributed because we are going to have these outbreaks because we're moving indoors. So I think all of those things will take time, but they will be the focus, at least one of the foci of the new administration. They have to be. You can't get the economy revved up without being able to control the virus, being able to open schools and daycare so kids can go there and their parents can work, and without then being able to open, restaurants, offices, and the other things. All of these elements, getting the virus under control, opening up the economy, stabilizing things, they're linked. And I think it will be the focus. And there's many, many things that new President Biden could do.
Only 45 seconds, Doctor. How concerned should people be about the pause in the Johnson & Johnson vaccine trial and I guess the Eli Lilly pause in their version of Regeneron trial? Quickly, if you can.
Well, you do have to be concerned. The good thing is that the clinical researchers will look and see if this was related to the trial or had some other circumstance. But both the AstraZeneca and the J&J trials use an adenovirus, and you've got to have some degree of concern. Maybe that's not the right approach in the end. The Russians also use an adenovirus. Maybe some of the other approaches will work. One of the good things is we have multiple approaches, multiple shots on goal to get not just one vaccine, but multiple vaccines that actually work. And the first one won't be necessarily the best one.
Well, let's end on the good thing because I like those. Doctor, it's great to see you as always. Thanks so much for your work. Appreciate it.
Thank you for having me, and I hope it was helpful.
It was.